Infant botulism is rare, but botulinum toxin is the main ingredient in Botox. People should recognize that it's used for paralysis of localized muscles as a cosmetic procedure. But if there's too much of that toxin in the body, especially in very young children, it can be very deadly disease causing generalized paralysis, difficulty breathing, and even death. It's produced by an organism, a bacteria that is typically not a serious cause of invasive disease, so most people haven't heard of it. It causes disease because it makes a substance, a protein called botulinum toxin, which is a paralytic protein that paralyzes the muscles. And so under rare conditions where you have large amounts of the organism, lots of toxin is made and you get this disease we call botulism. In the early days, I would say that 75% of the cases we see are in very young infants, less than 6 months, many of them less than 3 months of age. It was related to honey and using honey in their milk and because that's one place that the spores, this toxin, but in many of the recent cases that has not been true. People sort of know not to use honey. It's in the environment, and under rare conditions it grows to large numbers in the intestinal tract of these young infants to the point that they become sick. So it's present in the environment, it's relatively common. It's just extremely rare that we have children that get sick. To have 3 infants in the Tyler area is incredible. I would guess that the Centers for Disease Control and others will be out here trying to figure out what's so special about Tyler. I mean, 1 in a state is usually a lot. So having this many in a short period of time, it's really, really unusual. It's not, it's just these very young 3 or 4 month old infants who get the disease. So you can imagine that almost no one else gets ill from it. Those of you who get Botox don't need to worry. There's no living organism there. It's just a very small amount of the toxin is used for a good benefit in terms of cosmetic procedures. Well, it produces paralysis. So the child is weak, would have difficulty raising their arms, raising their legs, moving about, and trouble breathing. They have very shallow breaths and just anything that required muscular effort. So usually concerns about respiratory disease are the main things that bring them to medical attention. It's not an easy diagnosis to make because it's so rare. Even quality physicians sometimes put other things before it and make the diagnosis. Well, it's potentially fatal. I mean, the muscles by which you breathe become so paralyzed, and if you don't have supportive breathing, then you simply die of not enough oxygen. Now, if the child is really sick, they usually often go on a respirator, and they may be on the respirator for even several weeks until the toxin wears off and they get their normal strength back. Really, the key is diagnosis. It's such a hard diagnosis to make because it's not very specific in a young child who's just not doing well, and it's so rare. So, like many of these rare diseases, the key is in making the diagnosis. Depending on how sick they are, they're most likely to end up in the ICU. They'll be seen by a pediatrician, and it's on one of the things that the pediatrician would think about in terms of causing this sort of an illness, because they're infants. Almost always there's either a neonatologist or a pediatrician that deals with very young children. The problem seems to relate not only to the presence of this particular bacteria with its toxin, but the fact that the gastrointestinal tract of these very young infants is not mature yet. And the organism grows to very large amounts in the intestinal tract, lots of toxin, and then they absorb it from the intestinal tract. So actually it's a test of stool. The health department can arrange for the stool to be tested for the toxin. They also can culture the organism. There's some media used that's available to do that. So the health department really is going to be a big help here. Again, it's just thinking about the disease, and it's just something else for mothers of very young infants to think about. Depends on how much toxin they have, how much toxin they've absorbed. I mean, some infants have had to stay on a respirator up to a month. That's not normal. The usual would be maybe a week, maybe a little bit longer, in which they remain very weak, usually stay in the hospital. But again, once the diagnosis is made, it's supportive care and doing what we can about the toxin in the stool. Undiagnosed, it can be. It just turns off your muscles, and especially without respiratory muscles. And I'm not sure what the numbers are, but I'm sure if you look them up, there are cases every year that actually die from the disease. The diagnosis is made. We have about maybe a couple hundred cases a year in the U.S. Because it's not something you would normally carry in your pharmacy or you would carry in the hospital. This toxin that's made, there are a number of different kinds, 7 or 8 different kinds. So you need a specific medicine against that particular toxin. So identifying which one it is key to giving them the medicine. Again, the health department, in this case probably the state health department, are tuned into this enough to be able to help you get the answers that you need. It is, and often it's where people are doing research on the toxin, and then those are the ones who are likely to have antitoxin available or put you in touch with people that have the called antitoxin. But it's such a rare disease, there are very few people who work on it. If it is environmental more than it is related to the children, it surely has something to do with things that are different about the environment. It could be almost anything. Not a lot is known, but unfortunately it's not something that we could do anything about. You just have to be tuned into your baby, and when they look sick or they look ill, this is one of many diseases, you're going to have to take them to the pediatrician. Soil is just because that's where the organism normally lives. I'm not sure why this organism lives in honey or produces spores that are in the honey that will turn into the organism, but that's been known for a long time. Again, it doesn't happen very often because look at how many people eat honey, and even young children and even infants, and they hardly ever get sick. So there may be some genetic component to explain why so few people get it.